So today's topic is nutritional anemia. Those who have the textbook, it's chapter 11 in your dietetics textbook, page 207. Page 207, dietetics textbook, nutritional anemia. If anyone is joining late, please help them out with the page numbers. In new book, it is 255. So nutritional anemia, it's specifically anemia that is caused by nutritional deficiencies. Okay, there are different types of anemia. In one of the Wednesday classes of disease conditions, we will discuss that in detail. Okay, different types of anemia. Non-nutritional anemia is also there. For example, in case of any road traffic accident or any freak accident, okay, you lose a lot of blood. There is hemorrhage. Okay, there is a lot of external or internal bleeding. You lose a lot of blood. That will also put you into a state of anemia. Okay, that is not nutritional, but still it's anemia. Okay, then you have sickle cell anemia, thalassemia. These are genetic conditions in which the red blood cells in your blood is impacted. Okay, so those don't come under nutrition. Okay, so nutritional anemia is specifically lack of certain nutritional components, okay, which are very important for your body to make either red blood cells or hemoglobin. Okay, to make these two, red blood cells and hemoglobin, certain vitamins and minerals, okay, proteins, these are required. Okay, so when you're deficient in these specific vitamins, minerals, and proteins, your body is not able to produce enough amount of red blood cells. And in turn, there is not enough amount of hemoglobin. Okay, so that's how you go into a state of anemia. Okay. So nutritional anemia is caused by lack of iron, protein, vitamin B12, and other vitamins and minerals that are, for example, copper. Okay, copper is also required. It's a mineral that is required for uh, red blood cell formation. Okay, and that is needed for the formation of hemoglobin. Hemoglobin is that pigment that gives your blood red color. Okay, that's present in the RBC, hemoglobin. Okay, so the normal red blood cells, you can see, okay, the content, how it is spread out throughout your blood and how an anemic blood looks like. Okay, so below normal amount of red blood cells in your blood sample, it means you are anemic. Okay, there are different grades of anemia. We will discuss that later. So prevalence, World Health Organization, 30%, they have claimed that 30% of the world is already anemic, but it could be, the numbers could be much bigger than this. Okay, because a lot of anemia is often unreported. Okay, and young children and pregnant women are the group in the population that is most severely affected by anemia. Okay, and in India alone, 60% of Indian population is anemic. Again, it could be more than 60%. Okay, this could be more than 60%. Some of them are unreported anemic cases. Okay, and majority of the anemia is in rural India. Okay, as compared to urban India, rural Indian population, especially women population in rural India, are anemic as compared to males. Okay, and over half of the Indian women, even in the reproductive age group, they suffer from anemia. Menstruation is also a factor. Okay, menstruation, it's not the main, but it is one of the factor in women that could lead to anemia. Okay, so causes of anemia, this is important. The causes of anemia is important from exam point of view. There is a table in your textbook, table 11.1, causes of anemia. Those who have the new textbook, you can mention the table page number in the chat box. In new textbook, the page number is 256, table 13.1. So, in infants below the age of 1, okay, inadequate iron stores at birth because the mother during her pregnancy, she was anemic. Okay, so automatically the child born to the anemic mother is also anemic because they are born with limited storage of iron in their liver. Because when the child is born, for the first 6 months the child should be on exclusive breastfeeding. Nothing else should be given to the child apart from mother's breast milk. Okay, and the breast milk is not at all a good source of iron. So how does the child thrive for the 6 months of exclusive breastfeeding? It's because of the iron stores that the child is born with in their liver. Okay, and if the mother was anemic during pregnancy, the child will be born with limited iron stores in the liver. Okay, and so before the child attains the weaning age, okay, weaning age is the age that is about 6 months or around 6 months, 5.5, 6 months, when new food can be introduced. Okay, so about the weaning age, the child is already anemic. Okay, so in infants, either the child is low birth weight or even preterm babies, okay, they are also at a risk of being anemic. Multiple births, okay, like twins, triplets, quadruplets, infants who are breastfed by a mother who is a strict vegetarian. Okay, vegetarian diet will not have. So mothers who are strict vegetarians or vegan, they will also naturally have low iron stores in their body, and because of which they will not be able to uh, produce good quality of RPCs to pass on to their child. Okay, infant who is on a milk diet without proper weaning food. For example, if you're not feeding your child ragi, okay, like the millets porridge, when you're introducing new food to the child, okay, at that time, if you're not giving your child enough ragi or other iron rich food, because as soon as your weaning starts, as soon as the child is put on the weaning diet, the child has to be started with iron rich food. Okay, because the child does not have enough stores of iron. The child is almost finishing up its iron stores in the liver. So the as soon as the weaning starts, you have to make sure that the child is given enough amount of iron rich food. You have to start with iron rich food. Okay, iron rich food and citrus fruit, that you have to start with, okay, in weaning. And if the child's intestine is not able to absorb enough amount of folic acid or folate, okay, it is also a tricky vitamin to be absorbed. Okay, so if the child's intestine is not able to absorb folate, that also leads to anemia. Then certain diseases that the child is suffering from, like Crohn's disease, celiac disease, frequent diarrhea, rotavirus, okay, these can also lead to iron deficiency or even folic acid deficiency. Next, in childhood, again, dietary deficiency, the child is not eating iron-rich food. Usually, children don't prefer green vegetables, green leafy vegetables, so that is a problem here. And children are prone to getting hookworm infestation, worm infestation, etc. Okay, so that could lead to blood loss because any worms which are there in the intestine, that will take away all the nutrition. Along with it will suck on the blood of the from the intestine. So blood loss is also there. Then inflammatory bowel disease, if the child is diagnosed with that. Some social factors like neglecting the nutrition of a female child. Very common in rural areas. It's not that common in urban. cities or urban areas in India, but in some rural areas, still such social factors do exist where the female child, is not given good quality food or better education as compared to their male counterparts. Okay. And any intestinal blood loss because of a protein that is present in whole cow's milk. Okay. Certain children are allergic to proteins present in cow's milk. Cow's milk is also a most commonly food food sensitivity causing item. Cow's milk, peanut, these things. Okay, so that could aggravate or cause more inflammation in the child's tummy, and that could lead to low absorption. In adolescence, um, teenagers, females, as soon as they attain their menarche is the puberty. Okay, the risk of developing anemia increases, and growth spurt. Uh, Females attain growth spurt earlier than males. Okay, and when the growth spurt is happening, there is an excess requirement of nutrition from the in the body, and sometimes the food provided at home is not able to keep up with the nutritional requirements of growth spurt duration. Okay, so that could lead to anemia. Then and girls who take part in intensive exercises, PT classes, and not eating properly, suffering from anorexia, body image issues. Okay, early marriage in rural areas, if there is an early marriage of a teenage girl and she gets pregnant, there is a teenage pregnancy that could lead to anemia. Excessive loss of blood during menstruation. Girls who suffer from heavy periods, okay, heavy bleeding. So that's another reason. Then adults, any chronic infections like tuberculosis, cancer, okay, frequent infections as well, any gastrointestinal surgery that was done in which blood loss was there, or any surgery in which a subsequent amount of blood was lost. Okay, that could also put the person into anemic stage. A celiac disease in which the villi have become shortened, and too much of tannins, oxalates, anti-nutrients. Basically, anti-nutrients is present in your food, in your diet. If you're using pulses and legumes, okay, if you're not soaking your pulses and legumes for a specific duration, okay, that could lead to anti-nutrients that are not lost. It will be there even when you cook it. Anti-nutrients are still there, and this could be anti-nutrients could be a barrier in absorption of important nutrients. Okay, so like big legumes, okay, like rajma, beans and all, you have to soak them for more than 8 hours. Okay, if it is moong dal or urad dal and all, if you soak them for 3 to 4 hours, that is also fine. Okay, lentils at least half an hour to 1 hour if you're soaking, that is fine. Okay, so it depends on the size of the legume. The more bigger is the legume, you have to store at least soak it overnight, at least for 8 to 9 hours you have to soak them. Okay, soaking the legumes and legumes, lentils, pulses will make sure that when you wash it away, a lot of anti-nutrients like oxalates, tannins, okay, these are lost. Phytates, okay, these will get dissolved in the water and they will be lost when you wash it out, drain it out. Okay. Don't over soak rice because you will lose a lot of vitamin B complexes. Any worm infestation, which is very rare in adults, okay, that could lead to anemia. Certain drugs which are used to suppress your immunity. Okay, certain drugs even used in tuberculosis treatment can lead to anemia. During pregnancy, the requirement of iron and folic acid is high. But if you're having your average normal diet, your pre-pregnant diet, if you continue that, you will not be fulfilling the excessive requirement of iron and folic acid, and that puts you into anemic state. And increased parity means the more childbirths a woman goes through. Okay, parity means the number of times she got pregnant. Okay, successful pregnancies were there. So the more the woman chooses to give birth, okay, more than 3 children, more than 4 children, okay, the woman's body will be at the risk of being anemic. Then hemodilution, which means the blood volume increases a lot. Okay. For example, just imagine if you have 1.5 liters of blood in your body during pregnancy, especially during the third trimester, it doubles. Okay. It will be around 3 liters of blood in the body or more, depends on your edema. Okay. So there is a lot of blood volume, means what? A lot of water content is there in your blood. Okay. And if your bone marrow is not producing adequate amount of RBCs to keep up with this extra volume, okay, automatically your blood will be in a diluted state. Too much of water, too less of blood cells. So that also is a state of anemia. Then low maternal age, that is teenage pregnancies, very young girls getting pregnant. Even before the age of 20, if a woman is getting pregnant, that is also a high risk pregnancy. Then certain cultural beliefs and taboos, you should not eat that, you should not have this. It could be very nutritious food, okay, but still because of certain cultural beliefs or taboos, like don't eat papaya, okay, during pregnancy, these beliefs are there. Okay, nutritionally raw papaya is really good, okay, but because of these myth and practices and cultural beliefs, a woman may lose out on getting adequate nutrition. And other pregnancy related complications, if like there is bleeding during pregnancy and miscarriage that was almost going to happen but it was saved, there was some blood loss, okay, that could also lead to anemia. Infections during pregnancy. Then old age. So dietary deficiency in old age, especially folic acid, and with old age, the absorption rate of your intestine also goes down, and your intestinal villi, which are supposed to absorb nutrients, they atrophies. Okay, they become smaller, shorter, and even in number, they are reduced. Too much of bacteria in the intestine. Drugs that the senior citizens are taking for any chronic diseases that will interfere with absorption. Any psychological problems like depression, anxiety, stress, isolation, loneliness, okay, any inflammatory diseases that are chronic, for example diabetes and all, okay, for from the past 10 to 20 years, if somebody is suffering from such chronic diseases, they will be anemic. Okay, so is the causes clear to all? Coming to the types of anemia, so first one is hypochromic and microcytic anemia. Hypochromic means the color is less. Hypo means less. Chromic or chroma means color. Okay, so you can see here how hypochromic looks like as compared to the normal uh, RBCs. Okay, they are not that bright red in color. Okay, they will have a pinkish hue or a brownish hue. They are very light in color. Okay, not the bright red color. Microcytic, micro small, cytic means cell. So the size of the cell is smaller as compared to normal cells. So that is one type of anemia, hypochromic microcytic anemia. And then you have megaloblastic anemia. Mega means big, huge. Okay. But blastic means immature. These RBCs are bigger in size as compared to normal RBC, but they are immature. Okay, so here uh, it does not mean that the bigger the size of the RBC is, it can carry more oxygen, it can have more hemoglobin. No, the RBC is released by the bone marrow is kind of immature. It has to spend at least 24 to 48 hours in blood circulation for the RBC to mature. Okay. So these macrocytic RBCs, they are released by the bone marrow. They are bigger in size as compared to normal RBCs, but they are immature. Okay. Even if they are spending a week in your blood circulation, they do not attain maturity to function as a normal RBC. So that is megaloblastic anemia. Usually, vitamin B12 and folic acid deficiencies could lead to megaloblastic anemia. Then we have dimorphic anemia. Both iron and vitamin B12. Okay, both iron and vitamin B12 or folate. Okay, these things would be deficient in your diet, then it goes to dimorphic anemia. So in dimorphic anemia, di means two. Morphic means morphology, how it appears. Okay, so it may appear in both the types. It will be hypochromic and microcytic as well. Okay, you will find certain blood cells, RBCs, which are hypochromic. You will find other blood cells which are microcytic. Both of these two, okay, microcytic and hypochromic, both these type of blood cells are found in the blood in dimorphic anemia. It is because iron, folic acid, and vitamin B12, three deficiencies were present in the individual, and that's why the RBCs are behaving like two abnormal situations. Okay. Then you have iron deficiency anemia. Most common type of anemia in India, iron deficiency anemia, exclusively because of deficiency of iron in diet. So reason is inadequate iron intake, okay, like not having enough green leafy vegetables in your diet, okay, not having fortified food in your diet, okay, too much of processed food, raisins, jaggery, dates, these are good sources of iron. Okay, so people who don't have these kind of food in their diet, they may suffer from iron deficiency anemia. And also, how much ever iron content, okay, for example, it's almost 20 to 22 microgram for an adult, okay, approximately 20 microgram of iron an adult should take. But does the 20 microgram completely gets absorbed in the body? No, it does not. Whatever iron you are eating in your diet, hardly 3 to 5% of that will be absorbed by the intestine. Okay, remaining iron is lost in your feces. Okay, so especially pregnant women who are anemic, mostly it is because of iron deficiency. Okay, iron deficiency mother, anemic mother will give birth to children who have low iron stores in their liver. Okay. So inadequate utilization of iron. You may be having enough amount of iron. Your diet would be moderately rich in iron, but your intestines are not absorbing iron properly. Okay. So that is, see, the different types of anemia which we have discussed earlier: megaloblastic, dimorphic, hypochromic, microcytic. Okay. Iron deficiency, folic acid deficiency, any of these deficiencies could lead to any one of them. Your RBCs can act like any one of them. Okay, but usually it is seen that when it comes to dimorphic anemia, it's usually when all three things are absent: iron, vitamin B12, folic acid, all of these things are absent. This is how your RBCs will behave. Okay. How your RBCs will behave is what we have discussed earlier: hypochromic, microcytic, megaloblastic, dimorphic. This is how the RBCs will behave. They are not good for, they don't function properly. Okay. And then RBCs which are normal and which can function properly are very less in number. Okay. But what about the other RBCs which are abnormal? How do they look like? That was what we have discussed earlier. Okay. So when a person is suffering from some chronic gastric diseases like IBS, celiac disease, Crohn's disease. Okay, so there is some defect in their intestine, or a surgery that was done. There is a scar in the intestine. A part of the intestine was removed because of cancer or any of the reasons. Okay, any traumatic injury that happened to the intestine. So these could lead to less absorption of iron, less space for iron absorption to take place. So even if you have enough amount of iron, it is not being absorbed properly. Then blood losses, it could be either due to accident, okay, or due to some internal diseases which cause internal blood loss, like peptic ulcers that are bleeding ulcers, cancers, okay, uh, blood donation, too much of blood donation, accidents, worm infestations, heavy bleeding during periods, okay. This all leads to a lot of blood that is lost. That could also lead to anemia. Then even in pregnancy, after the child is being delivered, the amount of blood the mother has lost. Okay. For example, if it is placenta previa, if it is a case of placenta previa, in which the placenta is very near to the cervical opening, it's very near to the birth canal. So if the child is being pushed out of the uterus, there are high chances that the placenta may break along with the contractions. And if the placenta breaks during childbirth, it is a very critical condition, because placenta is rich in blood vessels. Okay, it gets a lot of blood during pregnancy, so it will lead to it will lead to heavy bleeding. Okay, and also if any pieces of placenta remains back in the uterus soon after the child is born, the placenta is will also be pushed out. Okay, so if some bits and parts of placenta remains back in the uterus, that could also lead to blood loss and infection. Okay, so that could lead to anemia. Then increased requirements. For example, coffee will not cause iron deficiency, but the caffeine in coffee will act as a barrier in iron absorption. So don't eat iron rich food along with tea or coffee, or even with your carbonated drinks that are rich in caffeine, like Red Bull or Coca-Cola, colas. Okay. Any food that is rich in caffeine, you have to avoid it while taking any iron supplement or any iron rich food. Okay. Caffeine will interfere with iron absorption. Then increased requirements, as mentioned earlier, during the human being's life cycle, when you attain growth spurt during your initial ages of puberty, okay, around 11, 10, 9 years. Now the growth spurt is quite young. Okay. So when the body has high requirements from the food, but the food is not able to keep up with the high requirements, that could lead to anemia. During pregnancy, the physiological requirements of a pregnant woman nutritionally is quite higher as compared to a non-pregnant woman. But if both of them are having the same food, it will not be justified. Okay, so that would lead to anemia. And even in lactation, during breastfeeding also, you have to take care of your iron requirement. Then inadequate absorption of iron, if there is diarrhea, okay, or you're abusing laxatives, too much of fiber in diet, okay, a part of your intestine is removed, too much of anti-nutrients that are present in your food, like phytates, phosphates, oxalates, like you're not washing your grains properly before cooking, not soaking your pulses, legumes, lentils before cooking. Okay, that would leave anti-nutrients back. Too much of tea and coffee. Okay, and certain conditions you're born with, like celiac disease, in which your intestinal villi is short. Okay, you're born with that. So automatically iron absorption is already very tricky. On top of that, your intestinal villi, which is supposed to absorb the nutrient, that is also short, that is not long. So it is double the factor that could lead to anemia. So coming to diagnosis, which all test can you do? So on page number 213 or in the new textbook, you can mention the page number. There is a table given. The name of the table is diagnosis of iron deficiency. Okay, you can mention the table number or page number in the chat box from the new textbook. In new textbook, it is table 13.2, page 261. So you can do a peripheral blood smear. Okay, you take you just poke the tip of your finger. Just you need 1 drop of blood. Okay, the blood smear will be taken, and now we have, just like how you have glucometer, you have hemoglobin meter as well. So that's blood smear will be used. A drop of blood is enough to understand how much hemoglobin you have, or what the size of your RBCs and all can be interpreted. Okay, then you have MCHC test, that is mean corpuscular hemoglobin concentration. Okay, it measures the average hemoglobin concentration in the blood sample that you have given. Okay, then serum iron test is also available. Total iron binding capacity is also tested. Transferrin is tested. Serum ferritin level is tested. So these are the different tests available through which you can identify what is your anemia status. Okay. So hemoglobin is the last stage of anemia. Okay. When hemoglobin goes down, it is known that you are anemic. But before hemoglobin goes down, there are other factors that goes down. Okay. Like ferritin and transferrin. Okay. Ferritin and transferrin, we will see that in the coming up slides in different stages of anemia, which is important. So that's why serum ferritin test, serum transferrin ferritin test, these are done. Transferrin is a protein. Okay, transferrin. So it helps in moving the iron that has been absorbed from the intestine to the liver. Okay, so iron molecules, as it is, they cannot travel in the blood. They require a help from this protein, that is transferrin. Okay, from the name itself, transferrin, transport of ferrin, iron. Okay, so transferrin, if it goes down, that means there is a reduction in iron stores. Okay, so the table that you see on screen, this is the WHO, World Health Organization, cutoff points for diagnosis of anemia. So in children up to the age of 11, if the hemoglobin value is less than 11.5, we put them in anemia category. Adults from 12 to teenagers, if they have hemoglobin below 12, it is called anemic. In adults, men and women have different indices. If men who are more than 15 years of age, including teenage boys, if their hemoglobin levels is less than 13 gram per deciliter. Okay, so if it is less than 13, it's anemic. In Non-pregnant women, if it is less than 12, anemic. In pregnant women, if it is less than 11, it is anemic. Okay, so these are the cutoff points of diagnosis of anemia. So stages of iron deficiency anemia. As I mentioned, hemoglobin is the final stage. When your hemoglobin is going down, it means that all these above factors have also gone down in your system. Okay. So stage 1, it is the decrease of iron stores within your body. So ferritin level goes down. Okay. In stage 2, transferrin goes down. The protein that is supposed to help in transferring or the movement of iron, that goes down in stage 2. Okay. Both ferritin and transferrin are dependent on iron. That's why when you don't have enough iron, ferritin will go down, then transferrin will go down. They are both dependent on iron. Okay. Stage 3 is finally iron deficiency anemia. That's the conclusion, in which hemoglobin levels have gone down below the cutoff indices that depending on the age group that you are doing the blood analysis. Okay. So stage 3 is iron deficiency anemia, in which the overall circulating hemoglobin is down because of it's not being produced. There is no enough production of hemoglobin. So coming to clinical findings, what happens when a person is suffering from iron deficiency anemia? What symptoms do you expect? First is immunocompetence. The T lymphocytes, T cells, that reduces. Okay. And also the antibodies that you produce in your body, that reduces. Okay. So automatically you are in a situation where you are prone to capturing a lot of infections. Okay. So your immunity goes down because of anemia. Then your work performance goes down. Even if you are at school, the children, how they function in school, okay, their school performance goes down. If you are a working adult, you will not be able to concentrate or give your best in your work. Okay. Always tired, lethargic. Even if you climb a flight of stairs, okay, you feel tired. Okay, you feel sleepy, drowsy most of the time. Cognitive development in children, young children who are iron deficient, it has been seen that they perform low in their academics. Okay, the way how they learn new language is also delayed. Their motor skills, if you throw a ball at them, how quickly they can react and catch a ball. Okay, these all are motor skills. Okay, their reaction and response uh, to an immediate action. Okay, that is delayed. Lack of concentration, behavioral changes, always irritated or agitated in class, troublemakers in the class. Okay, so those are the cognitive development. Then behavioral implications, they are more disruptive, irritable, restless in the classroom. Okay, it's very difficult to handle them for the teachers. Always they have a temper tantrum, and they also go into a stage of breath holding spells. When they cry in such a way that they are not able to take breathe. Okay, they will scream, just one big scream, but without their own control, they are holding their breath. Okay, they are not able to take a breath. Okay, so that is a sign of anemia. And when you start improving their iron deficiency, when you start giving them iron supplements, usually all these symptoms will also subside. Even the breath holding spell in children, that is also seen to be subside. Structure and function of epithelial cells. Epithelial cells are found in majority of your body parts, in your lining, inside lining as well. Okay, like tongue, nails, mouth. stomach lining, intestinal lining, they all have different types of epithelial cells. So they may become dried up, thin, okay? They may not, certain epithelial cells are functional also, like transitional, columnar. Okay, they are secretory as well. They can secrete certain fluids and mucus as well. Okay, so their function as well as structure is impacted because of anemia. For example, if people who have chronic anemia, they have koilonychia, that is, their fingernails are spoon shaped. Okay, usually if you see your fingernails laterally, it goes down. Okay, it have a convex structure, it goes down. Okay, but the people who have koilonychia, their fingernails, the direction of growth is upwards. Okay, so it's like a scoop. So it has a convex surface. Okay, that is koilonychia. Yes, pale patches, white patches also a sign and symptom of anemia. Stomatitis are also like the sides, the angles of your lips, okay, where both the lips meet at the sides. Okay, you will see ulcer formation there, dry skin there. Okay, angular stomatitis. So coming to the treatment, supplements are given, iron supplements in form of ferrous sulfate, vitamin B12, folic acid supplements are also given. Okay, because vitamin B12 and folic acid helps in the absorption of iron. Both of them, they're complementary. Iron is also complementary in the absorption of B12 and folic acid. And in diet, you have two different sources of iron, heme sources and non-heme sources. Heme sources are usually non-vegetarian sources, which are readily absorbed. Okay, iron from heme sources are very easily absorbed from the intestine. It is the non-heme sources, plant-based iron. Okay, those are the ones that are difficult to be absorbed. Okay, so heme sources, meat, poultry, organ meats, especially liver, okay, seafood. These are good sources of iron. In non-heme sources, dark green leafy vegetables, dry fruits, nuts, seeds, dark raisins, black raisins, dates, okay, ragi. These all are good sources of iron. Next type of iron anemia is folate deficiency. So again, causes is low folic acid in diet and age. The more you age, the absorption of folic acid decreases. People who suffer from alcoholism or any substance abuse, their absorption rate also decreases. And others who suffer from chronic diarrhea, celiac disease, a part of the intestine, jejunum, is removed. Okay, so that impacts the absorption. Then, based on demand during pregnancy, there is high demand of folic acid. If not kept up with, it leads to anemia during infancy as well. If the person is undergoing hemolysis, that is, a lot of hemoglobin is being broken down. Okay, certain disease conditions would also lead to hemolysis. Certain drugs could lead to hemolysis. Okay, then malignancy, cancer, severe dermatitis, because you lose iron from your skin as well. Okay, especially in winters. In winters, you lose a lot of iron. And also, it is in winters you get access to a lot of green leafy vegetables. Okay, if you see a dry skin patch, okay, when that the skin that flakes out, white flakes of skin that is very wispy, very lightweight, that flakes off into the atmosphere, that is iron loss. Okay, you can lose your iron content from the skin as well. Okay, so people who suffer from psoriasis, dermatitis, okay, severely dry skin, the iron loss in them is high. Okay, certain drugs, speaking on certain drugs, OCP is oral contraceptive pills. These are the other drugs. So clinical features of folic acid deficiency: sensations and weakness, sensations of weakness in the body, numbness and tingling feeling in the tips of the fingers and toes. When you touch the tips of the fingers or you touch the toes, you feel a numbness there. Here, sometimes even if it is not numb, there is a continuous tingling sensation at the tip of the toes and fingers. Ulcers in the mouth, okay, or even at the edges of the lips, like somatitis, and then sore tongue, inflamed tongue, general feeling of weakness, tiredness. So treatment: 5 to 10 mg of folic acid is prescribed. Okay. And if the hemoglobin is too low, very low, if it is less than 5 mg per 5 gram per deciliter, that low. Okay. In that situations, blood transfusion is prescribed. Eat more pulses, green leafy vegetable. If you're non-vegetarian, eat more liver, organ meat, fish, and eggs. Then you have hemolytic anemia, which means hemoglobin is getting broken down. Hemo means hemoglobin, heme, okay, lytic, breakdown. So it's an autoimmune condition, autoimmune hemolytic anemia. Too much of hemolysis, that is breakdown of red blood cells, is taking place. Your own system, your own lymphocytes or immune cells are attacking the RBC. Reason is unknown. It could be genetic as well. Idiopathic means unknown. It's not known. It's not clear yet. Okay. But it could be traced to certain side effects of some medications, any underlying disease conditions, inflammatory disease conditions, okay, that could lead a lot, allergy and all, which are not subsiding, okay, that could lead to hemolysis. So prevention: diet, balanced diet that is rich in protein, vitamins, minerals should be consumed. And anemia in initial stages, you can prevent it with diet. Okay. When hemoglobin also comes down, you may require certain iron supplements. But if you can catch it early, if you do a blood test and you see your ferritin levels or transferrin levels are coming down, it's below normal, just by dietary changes, you can correct it. Okay. But when hemoglobin has gone down, it's better to seek help of iron supplements. Then supplementation: we have a national nutritional program for the prevention of anemia. Okay, National Nutritional Anemia Prophylaxis Program is the name of it. So it's funded by the government. Okay, and their main aim is to, their main target is the sections of the society who are more prone to anemia, that is children and pregnant women. Everywhere, not just in India, but worldwide, children and pregnant women are the group of the population who are at higher risk of developing anemia. Okay, so the target will be in school and in primary healthcare centers, hospitals, secondary healthcare centers, maternity home, where you find a lot of pregnant women. In school, you will find the children. Okay, so especially for women during their last trimester, throughout their trimester, public free of cost iron supplements and folic acid supplements is distributed. And for them, for both the age groups, different doses are present. Okay, for expectant mothers, pregnant mothers, and lactating mothers, 60 gram of iron and 0.5 mg of folic acid per day is advised. Okay. When it comes to children in preschool, in school, okay, uh, below the age of 5, 20 microgram of iron and 0.1 microgram of folic acid is prescribed. It is distributed. Also under the MCH services, Mother and Child Health. MCH stands for Mother and Child Health Services, and also under the under five program. Okay, children who are under the age of 5, most of the death mortality seen in children is between the age of 1 to 5 years of age. Children who are between 1 to 5 years of age, they are at a higher risk of passing away because of certain deficiencies, disease conditions that were untreated or diagnosed quite late. Okay, so mortality rate is very high in children below the age of 5. Once they cross the age of 5, okay, whatever disease conditions they have, it is easier to diagnose it out, cure it, okay, and give a proper prognosis. Then education, focus more on nutritional education for women who come to PHC, CHC, women who are pregnant and they come for their antenatal visits. Okay, in every trimester, 2 antenatal visits they have to visit their obstetrician. So these are the best time to catch them and give them the education on nutrition, awareness on iron deficiency and all. Okay, and even post delivery, whenever the mother comes for immunization. Okay, every time whenever the mother comes with the child for immunization, for polio drops and all, these are also the best time to give them or at least hand over them pamphlets of nutritional education. Okay, going to the schools, uh, the girls' school or going to any school, giving children the dietary guidelines. Okay, teaching young women who are in school, high school, and all the importance of nutritional education given to them. Okay, so these are the areas where you have to target. How to get vitamin B12. Okay, how to get iron from food, how to pair certain food. These kind of education you have to give to the young mothers, young girls, children. Okay, so if you are giving this education to the children, they go home and they teach their parents as well. So that's why you have to target these groups. And also use of modern media, spreading the iron deficiency anemia awareness through media, through news channels, through radio, encouraging them to most of the people, they know you get iodine from salt. Okay, salt is fortified with iodine, majority of the population knows that, but not everyone knows that iron is also fortified. Now you have double fortified salt. Okay, you have the access to double fortified salt, that is iron and iodine fortified salt. Okay, so encourage them to use those salt. And also the distribution of anti-helminthic drugs to school children. Okay, that will get rid of any worms that the children have. Young children are at the highest risk of developing parasitic infections. Okay, they play in the mud, they don't wash their hands properly, they play outside without washing hands, they eat food. Okay, so they're at the higher risk of developing worm infestation. So distributing anti-helminthic tablets in schools. And fortification, as earlier I had mentioned, in India, salt, attas, legumes, certain food supplements, okay, milk, milk products, plant-based milk, these all come fortified in iron. Okay, there is a list of even some oils. Okay, in France and all, even oil is fortified with iron. You can use red palm oil. Red palm oil is also a good source of iron. But when you are choosing when as a government, when you are choosing a particular food to fortify, you have to choose a food that is accessible to each and every segment of the society. For example, when you take salt, everyone uses salt. irrespective of your religion, caste, your economics, your income, okay, your geography, wherever you are, whoever the person is, everyone uses salt. So if you fortify salt, you are making this nutrient accessible to the whole population. Okay, so that's how certain food is chosen for biofortification. And also iron fortification is now done in rice, sugar, milk, fish sauces, curry powders that you get. Okay, iron is fortified into it. Wheat flour and bread. In certain countries, they are fortifying wheat flour and bread as well. Using iron vessels to cook also can increase the iron content, but don't store the food. Soon after cooking in iron vessels, whatever you have cooked, move it to another serving bowl. Okay, don't keep it in the cooking vessel. Otherwise, it will get oversaturated with iron. It could lead to iron toxicity. Okay, so if you're using iron vessels on a daily basis, don't use it to store any food. Whatever you're cooking, remove it immediately after cooking. You remove it to another serving uh, bowls. Okay, it applies to copper vessels as well. Don't store the food in these vessels. So that's all for nutritional anemia. If you